Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. This is your weekly minisode where we'll provide a brief update on local public health news. Today we have Jenna Robinson, Executive Director at Saint Volunteer Transportation, here to tell us more about Saint and the services they provide. Jenna, thank you so much for joining us.
Thanks so much for inviting me.
To start, can you tell us about Saint and the work that you do?
Yeah, so Saint Volunteer Transportation uses volunteer drivers to help folks get around in Fort Collins and Loveland. We've been serving the community for over 40 years. These rides look like getting folks to medical appointments, grocery store, hanging out with friends at senior centers. We also give rides to individuals with disabilities. So those rides generally are for employment or getting to school. However, we give plenty of rides to individuals with disabilities that are grocery stores and coffee shops. And so really the purpose of Saint is just to make sure that everyone has access to the community and that transportation isn't a barrier for that.
How did Saint get started?
Yeah, so that was back in the 80s. A couple women, which unfortunately have remained nameless. I can't find the identities of these people, but they're geniuses. They noticed that in their neighborhood, folks that had to give up their cars were now housebound. And so, they started receiving requests, hey, do you mind taking me to the grocery store or whatever? And they thought, way more people would be willing to help if they just knew that this was an issue. And that's really how Saint was born. They started spreading the word. More people, of course, wanted to chip in and make sure that everyone had access, and take it off from there.
Now, how many rides does Saint provide on an average month?
Yeah, so we give about 1,700 rides a month, and that's between our two programs. So we've got Fort Collins and Loveland, quite substantial.
Who typically uses Saint services? Are there any criteria, or can anyone request a ride through Saint?
So Saint rides are available to anyone 60 and over, and there's no hefty registration process. It's literally your name, your date of birth, your address. So as long as where you are and where you're going are within our boundaries, then we can give you the ride. If you're younger than 60, so 18 to 59, there would need to be a disability that specifically prevents you from driving. So there is one added step in that process. We do have to have that verified, that your disability prevents you from driving. It doesn't have to be from a medical doctor. It can be from a caseworker in your life or a health professional in whatever capacity.
And you mentioned things like doctor's appointments. What all do riders use Saint services for?
Like I mentioned, we have the two programs, Fort Collins and Loveland. Loveland ridership looks a bit different than Fort Collins. While the program is the exact same, we give rides to absolutely anyone who's eligible to any place in our boundaries. Loveland generally uses Saint more for medical appointments. And medical appointments can also be the gateway for us too. They use us for medical appointments. Of course, they love the conversation they're having in the car with their drivers. Drivers are utterly fantastic. And so then, they find out, oh, well, can you take me to the salon to get my hair done every week? Yes. As long as we have availability, we would love to do that. And that's really what it comes down to. It's not the location or the person that takes priority. It's just whether we have availability in the schedule. We got a ton of drivers over the fall, winter-ish. And so Loveland is ripe for taking on a lot more individuals, which is awesome. In Fort Collins, we've got lots of what we call subscription rides. So people that use us every week to go to the same places at the same time. So Pilates classes, I mentioned work. We've got a number of people that we take to work every week, grocery store, going to the bank, of course, medical. So we give quite a number of dialysis rides. Routine rides, lots of variety. We have a number of riders who go to visit their family, one who visits her sister, another who visits her mom, one woman who goes to her daughter's house to babysit the grandkids. I mean, really, you name it. We want to help folks get there.
What makes Saint unique compared to other transportation supports?
These are completely free rides that we don't file with insurance. We don't charge. Our drivers do not want tips. They don't want to handle your money at all. So our drivers really are in it for the connections, for helping folks get where they need to be, not just for the well-being of the individual, but truly our community is better when we can all participate in it, especially when we're looking at a demographic, older individuals or individuals with disabilities, the friendships that are made in the car, because a lot of these drivers and riders share rides together frequently, is a really valuable part of it. And then the impact of that is increased well-being on both sides, right? On the driver and the rider. So
How many volunteers drive for Saint?
yes, I looked this up because they usually say, about 100. So we currently have 117 drivers. And not all of these drivers are routine drivers. So a routine driver would be taking a 4-hour shift once a week. We give rides from 8 a.m. to 4 p.m. Monday through Friday. So a 4-hour shift would be 8 to 12 or 12 to 4. We do have a handful of drivers that do that kind of bridge time of 10 to 2. And then we have the other volunteer opportunity when it comes to driving, which is a fill-in. So anytime a routine driver needs to go on vacation or has a medical appointment of their own and they can't cover their own shift, then we reach out to our fill-in drivers. So we have some fill-in drivers that drive more than a routine driver just because they're picking up so many of these fill-in opportunities. And then we have like snowbirds and stuff who only come in for a certain season, join the routine shift just for a handful of months, and then leave to fly away. So it really is quite a diverse range of volunteers, but there are 117 of them. And all of those are drivers. We definitely have other volunteer opportunities that are currently unmet. Social media is a huge one that we would love for someone who's interested to step into, but then also just like admins, just regular computer work. We would love for help in that space as well.
You started to talk about how transportation can often be a pretty significant barrier to accessing everything from healthcare to community services to social spaces. How do you see transportation play a role in health and well-being and community?
There's quite a bit of research out there that shows that the health disparity when we're looking between different people groups really comes down to transportation, not availability of doctors or even appointment times. It's folks actually getting to those appointments. So just in the medical space, your actual physical health, transportation is a cornerstone of that. And then if you translate that to other areas of our life, our social well-being, again, the party doesn't come to you. You got to go to the party. And so without transportation, that's just not going to happen. Our Fort Collins and Loveland have paratransit programs, and those operate within a certain distance of the bus stop. So if you live or can get to a certain range within the bus stop, then you have access to that paratransit. The other opportunity are these vouchers that you can get through the paratransit program. But those vouchers, again, you only get so many of them. And then when you don't have them, that's it. And so Saint kind of fills in that necessary gap of either living outside of that zone within the bus stop or those who have don't have vouchers anymore. Many of our riders have quite the toolbox of transportation options, which is really necessary. None of us who are offering transportation can do it all for every single person. And so having as many different opportunities and options in the community for individuals is really important to make sure everyone can stay active as they want and need.
Is there a particular story of social connection that Saint helped foster that you'd like to share?
There are too many. I was keeping them on Post-it notes in the office. So as individuals would call in, they don't realize that they're unloading a huge gem to you. They just think they're just telling you something fun that just happened. But when we hear it on the, in the office, we're like, this is exactly why we do the work we do. So I handed, they're all paper clipped, all my Post-it notes and random, emails that I've printed out that I got from drivers. Again, they're just offhandedly, oh yeah, the other day, ... I handed all of those over to my daughter so she could put them in a Google spreadsheet so I could have them. So I didn't have any of them when I was prepping this, but I can tell you, we've got a new scheduling software. We just started it mid-February, but it's got this efficient ride routing feature, which is the whole reason we invested in it. And that started March 1st. So we've only been doing this for about a month. And we've definitely reached many road bumps that we've had to slow down and assess and pivot. But one of the cool features of this efficient routing system is that it enables more than one rider to get in the car if they live in a certain area. So we've always given rides to, let's say an individual says, I'm going to go to the restaurant and my friend lives in the same apartment complex as me. And so she's going to join me for the same ride. Yes, awesome. Please get in the car together. But what this efficient routing does is it'll pick one person up. And if there's another ride that needs to happen close by, it'll go pick up that person and then drop them off wherever they need to go, usually in different locations. So this is not something that we've been doing routinely prior to this new software. So there's the context. So on a number of occasions, we've heard riders say that, and I should also preface this with, riders don't necessarily know that another person's going to get in the car for that trip. We don't know it in advance. So drivers just always say, hey, just so you know, we're going to pick up another person. Riders have been told if they don't want that, if they'd really like the security and confidence of having the ride alone, they can let us know. Just so you know, we try to cover our bases. We had one rider call in recently just to say, well, I had my first ride with the new system. And whenever I hear that, I always kind of like buckle in like, oh, this could go either way. And she said, oh, no, it was fine. And actually, there was another rider in the car. And again, this could go either way. So, double buckle. And she says, and we had the best time because, since COVID, I just can't get out like I used to. I usually only get out for medical appointments. So not only did I have the driver to talk to, I had a whole nother person and we just chatted the entire way. And that really is just so uplifting, of course, for her, but also for us who were in it for them, for the drivers and the riders. We had our board meeting this past Tuesday, and so one of the board members shared that her neighbor recently just had a shared ride as well. And it turns out that the two individuals who, in their minds, they were going to be strangers, they see each other, and they have this same aerobic class at the senior center together. So it was just an extra time to hang out with friends. So just serendipitous, really, really cool connections. So yeah, lots to share.
Yeah, thanks for sharing. If someone is new to Saint and would like to request a ride for the first time, how do they go about that?
Yeah, there's a couple different ways. On our website, there's a Ride With Us button, and then you can request rides. So it takes you to a Google form, and you put in your request there. I do want to make sure to preface that is just a request. It's not a schedule. So when you leave that, you still need to wait for the scheduler to call you back to let you know that there is availability and you have been scheduled. We don't have a lengthy registration process. You don't have to be registered for it with us for a certain amount of time before you can take rides. Really, right when you know about a ride you need and you've never ridden with us, you can drop it on the website, or the other way is to call. And that's the most popular way, 970-223-8604. If you need a ride in Fort Collins, that's extension 1. And if you need a ride in Loveland, that's extension 2. Those do go straight to a voicemail box, which can be frustrating. But because we get so many requests, that's really the best use of time for our schedulers is to pull them off in the order they received them, because we are first come, first serve. We do need at least 2 days notice. If you have routine appointments, or appointments that you already know about, like medical, far in advance, then you can go ahead and schedule those through our website or by giving us a call. If you have questions about the process, you have a certain ride, you're not sure it's in our boundaries, or you just want the confidence of knowing that, yes, it is, Saint is an option for you, then you would dial the number I already said, but hit extension 5. And that does take you to a live person who will really answer the phone. That's not a scheduling line. So if you left a request, that would still go to our schedulers and they would still call you back. But the phone or online are 2 great options.
And then for anyone who might be interested in volunteering to drive, what does that process look like?
Yes. So to volunteer to drive, or to volunteer with those other like admin needs or social media, or if you have a passion project and you're like, maybe Saint would be interested in this, please reach out. We probably are. So for those, you can leave your request through our website. There's a contact us form and a place that says something like, interested in volunteering. You would click that and then leave your information in the, box available. We get those daily. Those go to our volunteer coordinator, Teresa Holbrook. The other way is to give us a call. So it's that number, 970-223-8604. 8604, and then you would dial extension 3, and that takes you to our volunteer coordinator. You would just let us know what your interest is. If you have any questions about the opportunity, you could ask them there, although the website also has information about it. And then Teresa would send you the application. There's a place where you say, yes, I'm okay with having a criminal background check. So we'd go ahead and process that. Once that's completed, then Teresa reaches back out again to schedule the onboarding initial meeting. And so that's answering more questions, explaining how the process goes, finding out about the potential volunteers' availability, and setting up whatever that would look like, whether it's a routine shift or fill-in. And then that's usually about an hour and a half meeting with Teresa. And then the final one is a meeting with me. I mentioned our new scheduling software. There's a cool app that's associated with this new software that the drivers use, which again is we're ironing out the kinks on that. It's mixed reviews. So we've been in operation for 40 years and we've never had an app. So there's definitely a learning curve and a comfort to that. But setting up a meeting with me so I can go over what the app entails and answer questions on that. And then you're road ready.
Outside of volunteering, are there other ways that people can support Saint?
Whether you're a volunteer or not, writer or not, the most important thing you can do for us is spread the word. Letting your doctor know, maybe there are college students listening right now who really don't have very much interaction with seniors or individuals with disabilities, but they're in the doctor office and the doctor or the nurse mentions, it's tough for people to get here sometimes. Throwing out, I've heard there's a program called Saint that if they've got availability, we'll help people for free. So really spreading the word because we exist to help. So if we're not helping folks, then we're not living up to our mission. The next thing would be donating. So these are completely free rides. And as the old adage says, nothing is free, which is true in some regards. It is true that these are absolutely free for riders. It's not true in that, of course, there's gas money and insurance and the scheduling software isn't free. And all of those things are made possible because of folks in our community, grantors in Colorado who have given generously, the city of Fort Collins, city of Loveland, the county. All of these incredible partners make these rides possible. So check out our website, see what we're up to, reach out to us. We'd love to partner in a financial capacity as well.
Awesome. Jenna, thank you so much for joining us today.
Yes, this was too quick. Thank you. I thoroughly enjoyed it.
Do you have a question about public health in Larimer County or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.